The world is coping with an historic, deadly pandemic that we always knew was possible, but we prayed would not happen. In a bipartisan way, we did everything the experts said we needed to do to be prepared should a pandemic or other hazard strike. Madam Chair, the work you, Dr. Burgess, Representative Susan Brooks, and I and others did over 2 Congresses, when each party has controlled the House, resulted in one product, the Pandemic All Hazards Preparedness Act. Dr. Bright, I know you were part of our efforts in writing and reauthorizing that law, and we thank you for your work. In fact, given the role you once played at ASPR before going to BARDA, you had a big responsibility to make sure Congress provided the strategic national stockpile that it needed, or to inform us if there were shortcomings, especially as we were modernizing the Pandemic All Hazards Preparedness Act. I went back over 3 hearings we held in the Oversight and Investigation Subcommittee of this committee, where you testified regarding the Zika outbreak in May 23rd of 2017, the seasonal flu on March 8th, 2018, and the hearing on June 15th, 2018, entitled The State of U.S. Public Health Biopreparedness, Responding to Biological Attacks, Pandemics, and Emerging Infectious Disease Outbreaks. You see, I wanted to make sure we hadn't missed anything. Nothing jumped out at me as I reread the records. Congress dramatically increased funding to ASPR and BARDA. We granted new authorities. We followed your recommendations and those of others who played a key role in this combined effort. Unfortunately, some of the systems we put in place to prepare for a pandemic, systems designed without actually living through something like this, have not performed as expected. We've learned we didn't have enough of the basic supplies that we've always taken for granted. And while Chair Eshoo and I have warned about the potential vulnerabilities of our medical supply chains, especially from China, not enough was done to address the problem, and it still hasn't been fully addressed. I'm thankful that President Trump invoked the Defense Production Act to ramp up U.S. manufacturing of masks and ventilators. And the President's used the emergency powers and money Congress has provided to launch unprecedented efforts to search the globe for supplies, to rapidly advance development of treatments and vaccines. But we still have much bipartisan work to do to respond and adapt to the challenges presented by COVID-19 and the lessons we're learning. We have asked for, and this committee should hold hearings to find a path forward to reform the strategic national stockpile, to increase domestic manufacturing of critical supplies and disentangle our supply chains from China. We should be exploring strategies for increased testing so we can begin to safely reopen our economy. We need to find ways to improve access to mental health and provide relief both for our healthcare providers on the front lines treating COVID-19 cases and our healthcare workers who have been furloughed because their hospitals are closed. We should be conducting rigorous oversight of the trillions of dollars and myriad new policies Congress has appropriated and enacted in the last 3 months, and we should be really investigating allegations like Dr. Bright's that raise concern about our nation's coronavirus response. That does not appear to be why we're actually here today, and frankly, it saddens me. Dr. Bright, your allegations are serious. They deserve a real investigation. I know the Office of Special Counsel with whom you filed your complaint will do just that, and I know they take their work seriously and will hear you out, and importantly, will give those named in your complaint an opportunity to have their side heard as well. I must tell you that many of us on our committee were confused when we learned from a tweet this hearing was scheduled in the wake of your complaint. As you know, that's certainly not how we do things at the Energy and Commerce Committee. Not long after the notice of this being a whistleblower hearing, we were advised you were here as a government witness, not a whistleblower, but then we were told you were not representing the government, but yourself. The hearing title suggests the hearing's about protecting scientific integrity, yet the chair invited a witness who will not be speaking to that issue. So it's all pretty confusing and unusual to say the least. Here we are in the middle of a pandemic, and we aren't given time to secure our witnesses, conduct appropriate research, or require documents that could aid in our understanding of the situation you face and the country face. Our first discussion with the majority, unfortunately, just occurred 3 days ago. Look, this is really serious business, but in my opinion, this is not the way we should run an investigation. We need to get to the heart of the matter, and we need to look forward to see what haven't we done right as a Congress and a country, and what can we band together and fix before fall arrives? And so I thank you for being here. I've enjoyed working with you over the years and continue to look forward to working with you and others to get this right. And Madam Chair, we have a letter for you asking for a Rule 11 hearing that we'll provide to you. And with that, I yield back.